Would agree with you that obviously mental health issues and especially depression and anxiety is increasing amongst the teenagers, the youth as well. On social media, generally, everyone shows that they are happy. No one shows they're feeling depressed today or they're feeling suicidal. What you see on the media, that everyone is happy. And then you start to think about yourself that I'm not that happy. And that comparison between yourself and what you see other youngsters doing on social media, this will make you feel down, make you feel sad, and with other factors, it is possible that you will go into depression. If you get the 80%, we are happy. If you don't get the 80%, we are not happy. If you make an effort and you fail, I don't care.
Question is, a lot of people think depression is just feeling sad. How would you actually define it?
Obviously, when COVID came, lots of us lost their loved ones, elderly people. Post-COVID, there's been a lot of anxiety. The whole dynamics have changed.
And we get parents coming to us saying, my child's not confident enough, he's got low self-esteem. But we actually forget the cause. The root cause is the parents criticizing them a lot, over-criticizing them, or putting pressures on them about grades and stuff. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Heart to Heart. Today we have Dr Zeerak Nasim with us, and they're a mental health professional, and they'll help us tackle today's topic, which is mental health, but specifically depression. So I'll move on to Dr. Saab. Just wanted you to just give us a bit of an intro to yourself, your life, and...
Okay. Like you said, my name is Dr. Zeerak Nasim. I'm a mental health professional, and first of all, thank you very much for inviting me to come and be part of this podcast and share very important knowledge about mental health. I personally feel that within the Asian community especially, there is a lack of knowledge about mental health issues. And because of this lack of knowledge or lack of awareness, mental health is causing lots of problems, lots of issues, and especially with the youngsters and youth. So I thought it will be very important contribution towards your podcast. I was born and bred in Pakistan. I moved to UK in 1997, went to study medicine in University of Leicester, and then I trained in psychiatry.
MashaAllah, so you've trained at the University of Leicester?
Yes, I did my MBBS in University of Leicester in 2007. I completed my medical degree, and then I worked in NHS, mainly around the East Midlands and especially the Leicester area.
MashaAllah, I didn't know that. That's news to me, MashaAllah. And so the reason, you've already mentioned the reason why this episode is so important, and we thought that was the reason as well, because there's many of us youngsters who struggle with depression, but we don't really know what's going on, and our community doesn't know what's going on. And often there's a lot of misconceptions, and hopefully we'll tackle them today. So I'll get straight into it, but before, I always forget to do this, and I forgot to do this last time. It's an intro to myself. I'm Muhammad Zahir, and I'm a third-year medical student at the University of Plymouth. So hopefully I'll be able to have that sort of medical but also youthy conversation with Dr. Saab today. So Dr. Saab, I'll jump straight onto the question. And the question is, a lot of people think depression is just feeling sad. How would you actually define it?
Depression obviously is a medical condition. And just like any physical health condition, depression is also, mental illness. And we know from a scientific point of view that when depression happens, and we've got changes of hormone levels, especially neurotransmitters, or in layman's terms, happy hormones, their levels go down in depression. There are obviously sometimes these genetic factors, it may be running in the families. But most importantly, the important thing is that the depression is an illness. We should treat it like an illness. And it is not just about being sad. For example, if we, mostly on a daily basis, there will be circumstances, we may come across a challenging situation, something hasn't gone the right way, and we may be feeling sad. But just feeling sad is not the criterion to say that this person is depressed. So when we talk about depression as an illness or from a medical point of view, then we've got two most important or main important symptoms of depression. We call it as core symptoms of depression. What are they? First one of them is what we call as low mood. Okay, and low mood means that you feel sad. But how do you feel sad? Is that it's basically for a prolonged period of time, a minimum that you've been feeling sad on most days of the week for 2 weeks or more than that. Because if something happens temporarily, then feeling of sadness will go away either on the same day or whenever that problem resolves. But with depression, what happens is that you will be feeling sad most of the days of the week, and then for more than 2 weeks. And when it persists, that is the first criterion met. The second most important criterion is that lack of joy, lack of interest, things that you would normally enjoy, you are no longer able to enjoy. For example, going to college or going to school becomes a burden. If you are doing voluntary activities, for example, at the mosque, that again becomes a burden. You won't be able to focus on your studies and nothing gives you interest. For example, if you enjoy watching something on the TV, now even that same program doesn't give you any joy. So not being able to get the joy, and also the mood that is low for most days of the week and for more than 2 weeks, these are the two basic criterion, the symptoms that have to be there for it to be classed as depression. Then we have got other symptoms alongside that will come. For example, you will have struggle with sleeping. You may not be able to sleep, and when you do go to sleep, you will be waking up early. And then when you wake up, again, lots of negative thoughts going on in your mind. The other thing is that is commonly affected is your food intake, your appetite. You may not be, majority of the time people will feel less hungry. They will eat very little amount because they don't feel hungry, and they will start losing weight. That's another symptom of depression. Then comes the issues with the concentration, that you're not able to concentrate. You also will feel tired. So these are, most of the symptoms of depression that a doctor will actually ask you. And when you have most of these symptoms, then you will be classed as depression. So a very long answer to a question that depression is not just feeling sad.
I think that's a really good and detailed answer. And whilst you were telling us the symptoms and stuff, it reminded me of the time that I was on placement, and we got to see a young teen. He must have been 16 or 17, and he said that when I asked him how do you feel like, and I was like, what's your understanding of depression? And he said to me, it's like a fog that doesn't lift even on good days. And that answer made me reflect on it quite deep. I was like, that's a very deep answer, like a fog that doesn't lift even on good days.
Yeah.
And I feel like what you said, this it was a really good summary and really good detailed answer. And hopefully our viewers can understand and see what goes on, and if they have that, they'll be able to seek the help, which we'll discuss a bit more about. But do you think depression is more common amongst teen and young adults now than it used to be? Because I was looking at some statistics, and amongst adult, it said that in the UK, 1 in 6 adults experience common mental health problems such as depression, anxiety and stuff. And then if we look at young adults between 16 to 28, it said that about 28% were affected by it, and this was in 2023, so I'm sure this has gone up. And then if we look at another trend, it said that in 2021, about 41% of young people express feeling down, and this was like a very big rise from 2010, where it used to be, I think, about 15%. So why is this happening? Why is it becoming more common in young teens?
I would agree with you that obviously the mental health issues, and especially depression and anxiety, is increasing amongst the teenagers, the youth as well. And also, if you look at the admissions into hospitals, there is a significant rise in terms of youth being admitted into hospital with mental health issues, with depression. There are a number of different factors that why depression amongst the teenagers is on rise. Some of it may be to do with COVID. That obviously when COVID came, lots of us lost their loved ones, elderly people, relatives and so forth. And post-COVID, there's been a lot of anxiety. If you look at the turmoil, the financial crisis, and individuals losing their job, the whole dynamics have changed. When you look at the life itself, and youngsters do actually feel anxious that the future becomes very unpredictable, and when you have these uncertainties, that definitely makes you prone to mental health issues, and especially if you have those genetic risk factors where individuals from the families may have obviously had depression. That's one. The other thing is, social media has a big role to play in this. And I will explain how social media plays a big role in developing mental health issues. On social media, generally, everyone shows that they are happy. They are enjoying, they are having fun. No one shows their negative side, or that they're feeling depressed today, or they're feeling suicidal. So what happens is that what you see on the media, that everyone is happy, everyone's enjoying themselves, and then you start to think about yourself, that I'm not that happy, I'm not enjoying myself. And that comparison between yourself and what you see other youngsters doing on social media makes you feel down, makes you think negative about yourself, and you think that I'm not actually, happy and enjoying my life as much as other people are. And this will make you feel down, make you feel sad, and with other factors, it is possible that you will go into depression or other mental health problems. The second thing about social media is that a lot of bullying, cyberbullying that we call it, it happens. And let me tell you that even those individuals who come on social media very happy, but if you look at the comments that they receive, the criticism that they get in the comments, because they do have to respond to the comments to increase their audience. Because if you don't engage with the individuals who are commenting on your post, then your viewers will get less and less. So this is one way of increasing your audience, is by engaging in them. So they read these comments, and where there are negative comments, then you will see that this actually affects them. It sort of lowers their self-esteem, and they could be feeling depressed as a result of this. And sometimes we do see individuals who are coming on social media, and they say that these negative comments have affected them significantly. So cyberbullying, whether it is in terms of negative comments or the cyberbullying on its own as a separate topic, that's another big factor. The other third factor, I would say, is family dynamics. So relationship difficulties between the parents, so mother and father, or relationship difficulties between parents and children. There is, as we know, the times are advancing. There is huge change in moral values. There is huge change in for example, the older the generation, the less risk-taking behavior. They want to play more safe. Whereas with youngsters, the more you got warm blood running through your body, and you want to take risks. And this is when you want to take risks, and you want to go and do things. It leads to discord between the children and the parents. So that relationship difficulties, whether it is between the children and the parents, or between the parents themselves, for example, divorce or separation, single mothers or single parents, this also gives rise to lots of mental health issues within the youth. And then, although the list is long, but the last one that I would add is, again, the challenges they have to actually perform and do well in their studies, the expectation, and especially within the Asian community, that we have high aims that our children, they should either become doctors or accountants or lawyers. These are the three fields, and if you can't become a doctor, an accountant, or a lawyer, then you're useless. And over criticism, over emotional involvement from the the parents towards their children. So parents generally in Asian community, they tend to over criticize, and get overly involved in these decision making processes, and they don't give the children that freedom, the safe space where they should feel free to make the decision, and then parents guiding them. But what happens is the parents actually say, no, you can't do this, you can't do that. So these are some of the factors in this day and age, which I think is leading to more depression or more mental health issues within the youngsters.
I think the last one you mentioned, that's a very, very big issue. Like, we get parents coming to us often because again, I lead the youth and education department for the Yorkshire region, and we get parents coming to us saying, my child's not confident enough, he's got low self-esteem. But we actually forget the cause. The root cause is the parents criticizing them a lot, over criticizing them, or putting pressures on them about grades and stuff. And there was this kid, we did a youth retreat, and a kid was just talking to me about his GCSEs. GCSEs are coming up, and he was really stressed. And I was like, why are you stressed? He was like, oh, because I need to get good grades, otherwise I can't do anything in life. And I was like, who told you GCSE, if you don't get good GCSE grades, you're not going to be able to do well in life? And he was like, no, that's what everyone says. That's what everyone says. And I was like, that's not true. I was like, I'm doing medicine, and I did not get awesome GCSE results. I got grade 5s and 6s, which according to some people are really low. And I'm doing medicine, so you don't need A stars to do medicine. This is a misconception, and it's a fake pressure that people put on. In fact, you could get into medicine with just a grade 4, which is just a pass, a C. And but again, we have that pressure that you need to get a good grade. And this kid, he said he was working on a grade 6, which is a B. And to me, that was amazing. I was like, B is really good. You're doing really well. But he was like, no, if I don't get a grade 9, which is an A star, it was like, my parents are not going to be happy. I'm the only son. I need to get 9s. My parents are saying that I need to get 9. I have to get a good job. They're expecting so much of me. And I was like, you're only 14. You're only 14. You've got a big life ahead of you, inshallah. You've got a long life ahead of you, inshallah. But no, he had that pressure. He had that constant thing. And even though I was trying to talk to him, he still had that pressure. And the only way that pressure would have gone is if the parents did something.
I think this is very important point, although this is steering more towards parenting skills, but I will mention, because it can lead to this depression. The big mistake that we make is that we are goal orientated. I'll explain what I mean. For example, we say to the students, you need to get, let's say, 80%. If you get the 80%, we are happy. If you don't get the 80%, we are not happy. You have to get into medical school. If you get into medical school, good. If you don't get into medical school, we are not happy. That's goal orientation. And to be honest, with goal orientation, it is very dangerous. What our focus should be, effort orientated. Make an effort. Make a good enough effort. For example, I have, mashallah, 4 children as well.
Mashallah.
And, they come to me. For example, my daughter's, the early year, first year of GCSEs, and she goes, Dad, what if I fail? I say to her, look, beta, what you need to do is, I need to see that you are making an effort. You are doing your homework, you are putting an effort in, and you're not lazing around. This is the amount of effort that you need to make. If you make an effort and you fail, I don't care. But if you don't make an effort, and with tukka you get higher grades, I won't be happy because I didn't see you making an effort. And so when you tell the children, you make an effort, this is the amount of effort. For example, anyone, a student, what is, I feel as a reasonable good effort. For example, if someone's going to the school, and after the school on daily basis, they're putting 1 hour. 1 hour in. I can say that because when I was a medical student, all I was doing is I was putting 2 hours in consistently. And that was sufficient when I was doing it a medical degree. And you will know very well that with medical degree, the volume of work, the knowledge that you have to give, the books that you have to read and so forth. And if that is enough for 2 hours work on daily basis, then GCSE is 1 hour. Is probably more than enough on average consistently. And this is something that we need to tell the children, make an effort. If they fail after making an effort, no problem. Tell them, let's look at what went wrong, try again. Now what happens is a child makes an effort, they put their best in, but if they don't succeed, what do the parents say? You're useless. But that then demoralizes the child. You could get 80%, but not get into medical school. We know some youngsters in Pakistan, India have committed suicide because it was that pressure on them, because the expectation was there. But someone who's got 60%, they're very happy and jolly because their parents had different expectation. And you know very well that, okay, academic success, or what we call as IQ, intelligent quotient, is one part of your is one part of how good you are. The other part is EQ, what we call as emotional quotient, the how well you can actually deal with difficult emotions. Then there is the social quotient, the how well you perform with other individuals. So in our community, the only quotient that we worry about is intelligent quotient. And then what happens is, when these individuals, and sometimes you see that these what we call as so-called bookworms, when they go outside, they don't know how to deal with individuals. They don't know how to speak. And this is what I think, I was listening to your previous podcast with Wasim Bhai, the lawyer, and he said that when he interviews them, they have no experience. And this is what happens, that their parents have not focused on their social well-being. They've not focused on their emotional well-being. They've only focused on the, academic. So we have to obviously, as parents, you need to sort of like look at these other aspects as well, the how they can help their children. And this is where then the self-esteem will build, and the stronger the self-esteem, the more difficult circumstances or challenging circumstances you can actually sail through.
Inshallah, that's awesome advice. I know we went a bit into parenting, but I think that's quite important. I mean, again, us youngsters, we know that obviously this episode is focused on them, but we need to give a bit of guidance to the parents as well. And maybe you could show this to your parents and say, look, I know, you just need to know that I'm trying. The parents need to know that they're trying. And I think that's what parents need to see, that the kids, at least they're trying. And even if they don't get amazing grades, it's fine. It's not the end of the world. Allah subhanahu wa ta'ala is the one who provides. And there'll always be something for them anyway. So I know you mentioned this a bit briefly before about the symptoms and stuff and warning signs, but I wanted to focus specifically in the youth. So what are some warning signs, or that someone might be in depression? Like, what do we... So, because youth, they look fine outside. So I could have someone I'm teaching in madrasa and they look completely fine, but I don't know what's going on inside them. So what's some warning sign that I can look into for youth?
Okay, again, it is a difficult question, and it will also depend how severely they are affected. But I agree with you that many times you look at the person and you'll say that they look fine to me. It's a bit like when you take a car to the mechanic and they can smell from a distance there's something wrong with the car, and this is what is wrong with the car, and I don't have any idea. So if I have the expertise, then I may be able to recognize the telltale signs of someone who's suffering from depression. So again, I will say a few things. That, for example, first of all, you will see that they will start losing their confidence. So if you are as a teacher in the madrasa, you ask them a question, they will not be raising their hand. Because that tells you that they are, their confidence is low. Their self-esteem may be affected. They may be making negative comments about themselves. That, Ustaz Sahab, I can't memorize. I'm not good enough. I'm not clever enough. So comments like these as well. But if you purely focus on their looks, you will see that their eye contact becomes less. So they may not be looking at you. They may be looking down most of the time. And if you try to make eye contact with them, they will lower their eyes very quickly, because again, they make less eye contact. Confidence is affected. They will start making negative comments about themselves. The body language itself. So, for example, it will be kind of slumped shoulders, looking down, and a bit more floppy compared to someone with confidence, sitting up, forward, open arms, and so forth. So these are some of the things. And then if you look at their face, they will look sad, and they will not be engaging in any conversation. They will not be playing a proactive role. And if we look at the other sort of symptoms outside, is that the social activities that they used to do, they don't feel confident, they will actually not be part of it, they will become more shy, they will be spending more time in their bedroom. So even if we talk about the home environment, they would spend more time in their own room and doing their own activities, or just lying on the bed and sleeping around. You may look that their clothes are scruffy. Someone who used to pay good attention to their presentation is now no longer, they may be, the body odor may be coming because they may not be taking a shower on regular basis. They may not be well groomed in the sense of their hair and so forth. So these are some of the telltale signs that will tell that there's something not right. I'm not saying that it will be depression, something not right. And this is where you can pick up on this and you try to engage with them. We'll inshallah talk more about this later.
I mean, because the last point you mentioned about possibly body odor coming, so smell, or them not looking the best anymore. And I feel like nowadays we have got this stigma, and then people would start to laugh would laugh at them, or they say, oh, you stink, you smell, or they laugh. And they make joke of the way he appears, but no one actually thinks to actually look into him and maybe see, is he okay? He used to dress well, he used to smell all nice, and now he doesn't do that anymore. So it could be a sign of depression, as you just mentioned. But
and again, like you said, if someone's making a joke out of them, then it further antagonizes them. They will actually again feel emotional burden on them, because they know that it's not, they can't do much about it. They are in a difficult circumstances, they need help. But on the contrary, these individuals are making fun of them. So what happens is, this will then lead to what we call a social withdrawal. They'll be enjoying their own company, not being with other people, to avoid this sort of criticism or making fun.
So again, whenever we see something like this, I think we just need to focus and just pay attention as to what we're saying and what we're doing, because someone might look fine, they might be playing with their friends, they might be posting online and stuff, but we don't know what's going on deeply inside. So again, it's just a message to the viewers, as Dr. mentioned. We just need to be careful of what we say. And if you notice someone has just changed, maybe ask them, are they okay? Because again, us youth could play a big part in some other youth's help, or our friends.
Absolutely. And the other phenomenon is that usually with people who are suffering from depression, they will initially be trying to put on a face. They will try to look brave, and they will try to push themselves to be as normal as they can, so that either to hide their difficulties or they don't want to share. But every now and then they will be giving these signals that something is wrong. And if we are sensitive enough to register those signals, then we can help them, because they need someone trusted, someone who they can listen to them, and this will then lead to resolving this issue, resolving this problem. And this world is a funny thing. What goes around comes around. Today someone else is in problem, you help them. Tomorrow I'll be in problem. If I've helped someone today, inshallah tomorrow someone will help me,
inshallah. And yeah, again, really important points Dr. Sab just mentioned. I'll move on to the next question, which is sometimes some people say things like, just pray it away and it will go away. Is that advice helpful? Is it harmful, or is it both?
I think if someone tells someone that, look, you just need to pray, and this is something I see quite frequently happening when we travel in Madani Kafilas in Dawat Islami. And someone says about these things, and I'm sitting there and I'm listening to sort of get a better idea. But someone else in the Madani Kafila, who are not an expert, they will suddenly jump in and say, you just need to pray, you just need to pray, you just need to read the Quran Pak. Obviously, praying, reading Quran Pak, Durood Pak, this is part of the healing as well. However, there is a stage for it. And in the first stage, they need to actually get expert help and guidance. Okay, and I would say the first, listen to them and make their mindset to actually go and seek help, which is from their doctor, GP. Go and speak to the GP, discuss these problems and so forth. And me as the individual, I first need to sort of like listen to them and say to them, look, I think there are some issues. Why don't you go and see the GP? Why don't you go and see the doctor? And it is possible that, when we talk about depression, you would remember that I mentioned 6-7 symptoms.
Mm-hmm.
If someone has 3 or 4 symptoms, we call it mild depression. If someone has got 4 to 6, 7 symptoms, we call it moderate depression. And then, more than that, or other additional symptoms, what we call as psychotic symptoms, maybe hearing of voices or these, other things, then we call it severe depression. Someone who's in severe depression may need urgent help because they are at risk of either committing suicide or harming themselves or it further deteriorating. And at that time, sometimes hospital admission under supervision is needed, and they need a lot more supervision even inside hospital. With medication, sometimes severe depression requires other forms of treatment as well. So that for that stage, saying that go and pray and just pray it away is counterproductive. It is damaging. And that individual may start doing these things, but it doesn't give them the result at that particular time. Then we talk about the moderate depression. With the moderate depression, again, it is something that you will need to refer to the GP. When someone is in mild depression, low level of depression, this is where sometimes supportive counseling, where when we talk to them, we listen to their emotions, and we try to neutralize them, and we try to give them the sound advice which makes them feel better. And plus, obviously, praying and reading Quran Pak, then that is the part of the recovery process. And yes, as a many times when you see a psychiatrist or when you will go to the GP, then the after initial treatment with medication or therapy or whatever, there is the recovery plan, and the recovery plan includes social engagement and social activities. So if we look at it, that context, praying namaz in the masjid is a social engagement. When you will go there, you will say salam to people, and general chit chat. It actually makes you feel good. And again, reciting Durud Pak or doing tilawat and so forth, it strengthens your spirituality. And the stronger the spirituality, the more resilient you will be. The mental health is the stem of the tree. That if you cut the stem, tree doesn't exist. Ultimately, even according to the Islamic teachings, a lot of it boils down to emotional control. And mental health is all about emotional control. Now, if anyone with mental health problems, they say that I'm going to kill myself or I'm going to harm myself, always take it very seriously.